The next transfer we will demonstrate is the sit to stand using a walker, but with a patient that has weakness related to Parkinson's. Patients with this diagnosis tend to hold most of their weight on their heels. They are at a higher risk for falling backwards because of how they distribute their weight. They can transfer safely with a walker, but it is important to understand the nuances of assisting these patients to keep them and you safe. Get the patient positioned the same as with the other techniques. Edge of the bed or seat, with toes below their knees or knees bent at 90 degrees. Have the walker in front of the patient and ready to be used, but never have the patient grab onto the walker before they stand. Position yourself to the side and posteriorly. Unlike the lateral scoots with one-sided weakness where the patient would probably fall forward or to the weak side, Parkinson's patients will probably fall backward because of how they hold their balance. So you should position yourself posteriorly to protect against that. Ask the patient if they have a weak side, which is possible with Parkinson's, and if so, try to position the patient so that they are transferring toward their strong side, and you will be positioned on the weak side and posteriorly to protect against a fall. Instruct the patient to bend over to get their nose over their toes. They need to lean over a lot, probably more than the patient realizes, so encourage and cue them to bend over fully.
Nose forward, 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 lean forward.
Then push up from the armrest to stand. When standing and still leaning forward, grab the walker with one hand and then the other. Then stand up. The Parkinson's patient will start to put their weight on their heels, so you will likely have to continue to prompt them to lean forward.
And now, lean forward, lean forward, lean forward. Try and find your balance.
And find their balance. Stay close to the patient, guiding and supporting from the gait belt as you instruct them to take small steps rotating toward the bed. With their back toward the bed, have them take small steps backwards to get close to the bed. The Parkinson's patient will now have a tendency to lean back over the bed, which can quickly lead to them losing their balance and falling onto the bed as their feet slide out in front of them, which we want to avoid. Prompt the patient to continue to lean their nose forward over their toes to keep the weight forward as they sit. Prompt the patient to sit by bending their knees, leaning forward and keeping their nose over their toes for the whole process. This keeps their weight balanced as they sit and helps avoid the fall. Continued verbal cues are always beneficial, especially with these patients. You need them to keep their weight more balanced than they naturally want it to be. If they aren't actively trying to lean forward, the Parkinson's patient will always resort to holding their weight over their heels. So keep talking and prompting through the entire transfer.
As much as you can. Yep, bring your nose forward, bring your nose forward. More. Bend forward, so bring your nose over this. Come on, forward. Now bend forward and start to kick your butt back. Sit on the edge of the bed. So reach back, sit on the edge.